Bismillahirrahmanirrahim. Hi dear students, today we'll cover the topic of thermal burns and death due to burns. Thermal burns are a prominent cause of death both in civilian life as well as in modern warfare. Chances of survival after extensive burns are better in advanced countries, but in our country, even 30 to 40% burns at times can become fatal because facilities are not proper to treat, to handle, to manage such patients. We will study the topic under various headings. We can have SEQ from this portion, like what is a burn, what are types of burns, what are various degrees of burns. Well, burn is a traumatic lesion caused by the application of heat or chemical substances to the external or internal surface of the body, causing the destruction of tissues. Classification of burns. Burns can be thermal burns, which can be of two types, caused by flame or highly hot solid object, called dry burns, and then burns caused by highly hot liquids or by steam, called scalds. Second type is corrosive burns. These are caused by strong acids like strong hydrochloric acid, sulfuric acid, and nitric acid, and also caused by strong alkalis like sodium hydroxide and potassium hydroxide. Third type is electrical burns, electrical lesions, caused by electrocution and also by lightning. The type is radiation burns, caused due to X-rays and other ultraviolet rays. This picture shows a sunburn due to ultraviolet rays. Lesion. Vital tissue response depends upon the intensity of the cause. It varies from simple redness, simple erythema, to different degrees of burning, and at times whole body is reduced, is converted into ashes. What are various manifestations of burns? The burns show redness, blistering, destruction of tissue, scorching, charring, and blackening. When rupture of the blister occurs and epidermis is removed, there is a pink surface from which fluid oozes out. Lesion shows evidence of repair after few days on naked eye examination. Now, what are various degrees of burns? Number one, superficial or less than full thickness burns involving epidermis and some part of dermis. Second degree, deep or full thickness burns involving the whole skin and the deeper tissues. But the important point is that lethal effects depend upon the surface area involved and not on the depth of the burn. Rule of 9 to determine area of burns to determine area of burns of body is very important, and it is applied to know how much area of the body is involved in burns. This picture shows partial thickness burn, superficial burn. This picture also shows partial thickness burn in stage of healing. Law is more concerned with the effects of burns rather than the cause. Recognition of cause and type is essential only for correlation. Characteristics of dry thermal burns. There is redness or erythema, coagulation of tissues involved, singeing of hair, burning of hair, burning of clothes, but vesicle formation or vegetation is minimal, and black colored carbonaceous material is present in dry burns. Characteristics of wet thermal burns caused by hot liquids like hot water, hot oil, or by the steam. In such type of burn, vesicle formation is very prominent. Singeing of hair is not there. Burning of clothes is not there, which is there in dry burn. Clothes and hair may be found soiled with the type of material, with the type of liquid used. Maximum damage is at the point of contact, and there is no carbonaceous material, no black material present in these burns. Now we will discuss complications of burns leading to death and various other medico-legal aspects of burns. Number 1, mechanism and mode of death in cases of extensive burning. The person may die due to neurogenic shock as a result of extreme pain. It is said that superficial burns are very painful as compared with deep burns. Person may die at times within few minutes. Second effect can be secondary shock and collapse because fluid is lost, body fluid is lost in the areas which are burned, and this leads to hemoconcentration. In such cases, death can occur within few hours. Third complication of burns can be toxemia. Toxemia leading to failure of organs like liver and kidneys. In such cases, death occurs usually in 24 to 36 hours. Secondary infection can occur after few days, and it can lead to septicemia and death. It is said that when area involved is 1/3 to half of the total, the outcome is fatal. Another medico-legal aspect and very important question to decide on autopsy examination is whether the burns present on a dead body are antemortem or postmortem, whether they were produced before death or after death. Presence of few findings determine this. If vital reaction is present, it will mean burns are antemortem. If vital reaction is not present, then burns can be declared as post-mortem. Vital reaction, as you know, it means signs of inflammation on microscopic leukocytic infiltration, especially polymorphs, and level of few enzymes is found raised in the area around burnt tissues. If this vital reaction is present, burns are antemortem, otherwise postmortem. In addition to that, postmortem staining is of pink color because of high level of carboxyhemoglobin. It may be there up to 70 or 80%, leading to death. As I already told you, vital reaction in the margins of the burns indicates that burns are antemortem. If soot or smoke is present in the air passages mixed with mucus, it also indicates antemortem burns. And carboxyhemoglobin level in the blood, if it is enormously raised, indicates death due to burns. Another question can be, what are various artifacts found in burnt dead bodies, in which cause of death is burns? Artifact, in fact, is not a true finding. It is a false finding which an untrained autopsy examiner can take it as true finding. In fact, it is false finding. Artifact is a fact which is not a fact, but it is considered as a fact by the untrained examiner. In cases of these dead bodies, heat rupture, because of extreme heat, there may be rupture of the skin and underlying tissues. These open areas resemble incised wounds. In fact, these are not incised wounds. It is due to the effect of extreme heat, which shows some open wounds, but these are not antemortem incised wounds. Second artifact can be heat hematoma. There is swelling on the scalp, and it is not due to trauma. It is due to the effect of extreme heat. The clot presents honeycomb appearance and it is of chocolate color. It is the effect of heat. Then we can have heat fractures on the vault of the skull. In fact, these are not traumatic fractures. There is separation of the sutures because of extreme heat. Another artifact can be if the cloth on the neck is there and it is intact. It is not affected by the fire. You remove this cloth, piece of shirt, piece of collar of the shirt from the neck, and you find some normal tissue there. This band-like area may resemble ligature mark of strangulation. It is not a ligature mark of strangulation. In fact, it is the effect of burns. Some piece of cloth of shirt collar remains intact, and when it is removed, underlying area is normal, It resembles the ligature mark. In fact, it is not ligature mark. Similarly, due to extreme heat, blood vessels they get ruptured and liquefied droplets of fat, droplets of subcutaneous fat, they are absorbed into circulation and reach the pulmonary vessels, and they lead to fat embolism. It is not traumatic fat embolism, it is fat embolism due to effect of heat. It is said that autopsying burnt dead bodies must be as complete, as thorough, and as cautiously performed as in any other important case. Now I will show you a few pictures of burnt dead bodies. Here is a case of kerosene oil burns. You can see red areas. Redness shows that burns are antemortem. Here eyelashes, they are burnt and singed. There is blackening of tissue, body tissue, skin and other tissues. It's a case of dry thermal burns due to kerosene oil. These are scars due to highly hot liquids. This is burning of the large intestine. This model shows dry burns. You can determine area of burning on the basis of rule of 9. You apply rule of 9 to determine area involved. For example, for head and neck, 1 9 is considered. For two upper limbs, 2 nines. For back of trunk, 2 nines. For front of chest and abdomen, 2 nines. 2 nines for left lower limb and 2 nines for right lower limb. You have to count 11 nines, that means 99%, and 1% is left for the genital area. So this is how rule of 9 is applied to determine area of the body involved in burns. Children are more susceptible to burns. These are dry thermal burns. Well, we stop here. Thank you very much.